Hi parents, my name is Aisha Grayson and I am a current psych major at Wayne State University. And today I'm going to be talking to you guys a little bit about oppositional defiant disorder. So before I talk about the underlying symptoms of oppositional defiant disorder, I'm going to be giving you guys a brief definition of what it is. So in my own words, oppositional defiant disorder is basically a disorder where a child is defiant and does not listen or have disobedient or inappropriate conduct towards authority figures. Now, going into the 6 symptoms, according to psychguides.com, 6 symptoms and how you can identify child opposition defiant disorder in your child is 1, the child easily gets annoyed or nervous. 2, the child often gets angry. 3, they put blame on other people. 4, they refuse to follow rules and question authority. 5, they argue and throw temper tantrums. And 6, they have difficulty handling frustration. So to break down those 6 symptoms, I'm going to use an example of food and how it's presented to the child and the way the child reacts and how you can identify the 6 symptoms to get help with ODD. So going back to 1, the child easily gets annoyed or nervous. If a child loves the meal mac and cheese and you present the child with broccoli and cheese and chicken or something that helps boost their immune system, that helps produce growth and health, and just any healthy food that or any food outside of the mac and cheese that the child wants to eat. If the child is getting annoyed with you by not presenting them that food, that is one way you can identify ODD. Going to the second symptom, the child appears angry. So spinning off from the first symptom, if the child begins to get aggressive or angry with you for presenting them with other food outside of the mac and cheese, you can also identify that as ODD. So going into the third symptom, using that same theory of food, say for instance, the child has a sibling and a dog is as a pet, and the mom or dad, whatever parent, present the kid with a certain food outside of mac and cheese, and they take the mac and cheese, throw it on the floor while the parent isn't looking, and the sibling gets blamed for the meal being poured on the floor. The child will blame the sibling because they believe that this will help them get out of the trouble in the situation, or just anything like that. Moving on to symptom 4, refusing to follow rules or questioning authority would be if your child just refuses to take the meal and eat it. Like if you present them with if you present them with any food outside of the mac and cheese and they decide, hey, mom, dad, I'm not going to eat this at all, and they just kind of brush it away. 5 is arguing and throwing temper tantrums. It's like a spinoff to symptom 2 of being angry, but just like next level angry. So they kind of gets fussy. They just literally blatantly like refuse to eat it, and they just kind of like start screaming, hollering, just all around tantrum. And then 6 is having difficulty in handling frustration. So when the child is having this breakdown or this meltdown about not being able to be presented or consume the food that they want to eat, which is the mac and cheese, then they are not able to contain how they feel about it, and they have like this outpouring cry or this outpouring yell or tantrum, and they don't know how to stop it. So those are the 6 symptoms. Treatment can be found through child behavioral therapists. My current professor is Rita Casey. She is a child psychologist. She's a professor at Wayne State. And so people like her can give you a better breakdown of how children can be treated. Also, keep in mind that ODD symptoms are for children who experience symptoms for 6 months or less. The children of ODD are at a high risk of receiving other disorders, behavior personality disorders, such as conduct disorder. But to prevent things like conduct disorder, you can take treatment efforts to reduce the symptoms or the outcomes in the future. Thank you guys for watching this video. I hope it informed you. I hope you gain some type of understanding of what oppositional defiant or disorder is, and seek help. So thank you guys again, and have a good day.